All right, ladies and gentlemen, so welcome to our heart dissection. Now, there are two hearts here. This one is a sheep heart, and this one is a pig heart. I have them side by side for you guys here so you can see kind of the difference. So the sheep heart is slightly smaller, but the pig heart is roughly the size that our human hearts would be. Okay, so both of these right now are sitting so that the anterior surface is facing up. Okay, so in the chest cavity, they would be sitting with this pointing anteriorly. This aspect right here is your apex. So on both of them, the apex is the pointed part, and that is going to be pointing inferiorly. Okay. And then the base is the wide upper portion. Okay, so when we are looking at these guys right here, there are a few features that we want to be able to find on the external surface before we do any cuts whatsoever. So we're going to go ahead and go through those first. So we already mentioned the apex on both of them are the narrow portions that are on the inferior side. It would be sitting in your chest like this. We also have the wide base at the superior portion on both sides. Okay. So from here, we're going to go ahead and point out a few important features. Once we cut it open, we'll get a good look of the ventricles inside and the atrias inside, but as you can imagine, the ventricles are closer to the apex and the atria are closer up here by the base. Now, the atria have next to them these structures right here. You can see these kind of structures that stick up. These are auricles, and the auricles are found on both sides here and here. And on the sheep heart, we can see them here and here. And these auricles are extra flappy areas that can fill with blood if necessary. Okay. The other things that we will point out from the external surface are mostly going to be blood vessels. So we've talked about coronary blood vessels, and coronary blood vessels are, of course, the small blood vessels that feed the actual tissue of the heart muscle or the cardiac muscle tissue. And you can't really see them here very well, but you can see the places where they would have been. These are very delicate, and you can maybe see them collapsed here a little bit, but they would come down this way and then branch out across. And you can see this one coming here. You also can have some going on the posterior side. So you see one here, and this one would come down this way, this one would come down this way, and on the pig heart, the same thing. It's going to come down this way, and you can see also coming across this area. Okay? Now, those are the small coronary vessels. When you get to anatomy, you're going to need to know all of the different vessel names, but for right now, we're just going to call them coronary vessels. Okay. The larger vessels, though, we do need to have a good handle on. So, anterior side here, we have this large vessel that's going from the anterior side across, and so this is your pulmonary trunk. Your pulmonary trunk would, of course, branch into a right and left pulmonary artery. Okay, so that's the pulmonary trunk coming across from the anterior side. Here, just posterior to that, we have our aorta. So this is the first part of the aorta. The aorta, of course, would continue on in an arch, which has been cut off. Okay. Also, let's see, can we see any other ones? That might be it for the moment. We have a cut piece right here that is most likely part of the superior vena cava, but it is difficult to tell until we cut this open. So I think as far as the great vessels, that as much as we'll look on here. Similarly for the sheep heart, we have our pulmonary trunk here. It's coming across the front side. Then we have our aorta. And this most definitely would have been an opening into the superior vena cava. They cut it so low that we can actually see into the right atrium without having to actually cut in. Okay, so this one was done for us, and we have another one that's been cut off here as well, allowing us to go into the heart like that. Okay, so from the external portion of our sheep heart and our pig hearts, that's as much as we need to see for now. All right, guys, so now we're going to look at how to actually do the dissection of the sheep heart, which is the one you should be dissecting for yourself. So just as we have mentioned before, make sure the blade is pointed away from you. Okay, you're always cutting away from yourself. So with the sheep heart, there's several different ways that you can do the dissection, but what we're going to do is we're going to go ahead and find the apex of the heart and go ahead and put your scalpel in like that, just so you're about to the end of the blade, and then you're going to slowly cut up through the left side of your heart. You might have to do a sawing motion to make it work, or you might be able to just go straight through depending on the sharpness of your blade and the ease of your heart. Okay, so I'm going to just go ahead and put this down for a second so that you can see what I did. So I did a cut all the way across. Now this is not going to be enough. We're going to have to cut the other way too, and then we'll probably have to deepen these cuts. So I'm going to go back in at the apex, and now I'm going to cut the other way. Now you'll notice I'm cutting away from myself. At no point is the blade moving towards my gloved hand, but my gloved hand is anchoring the heart in place so that the heart doesn't move anywhere. Okay, and so that is enough on both sides. Now, when we start to pull apart though, we see it's still attached. So what we need to do now, very carefully, pulling it open, and I can't show you and do this carefully myself, so I'm going to have to look down myself here and just cut down any tissue that is holding it back. Okay, so I'm going to go ahead and open it up here, and you can see how this looks. Okay, so we've just cut through. This is of course a coronal or frontal cut of the sheep heart. All right, guys, so now that we're inside of the heart, we're going to look at a couple more things before I do any more cutting. And essentially, we need to make sure we're oriented. Now, we had already picked out which side was the anterior, which side was the posterior, which side was left, and which side's right. But once we're inside the heart, we can confirm that we're correct on all those things. So you can see that there is a small chamber here, and then there's another chamber here, but it has much thicker walls. You see the thick walls here and the relatively thin wall on this side. So both of these are ventricles, but one ventricle has a thicker wall than the other. Any ideas which one's which? Good. So the thinner walled ventricle is going to be the right ventricle, because the right ventricle only has to pump into the pulmonary circuit, whereas the left ventricle has to pump into the systemic circuit. So it has to be able to pump blood all the way to your toes and all the way up to your brain. But the right ventricle only has to pump to your lungs, which isn't very far. So because of that, the muscle is much thinner on this side than it is on this side. Okay, so if you were in doubt when you were looking at the external surfaces, this is the quick and easy way to make sure that you are correct. Okay, now I do want to just make sure we're oriented here. So the apex of the heart is still up here, and the base of the heart is down here. Now, the reason why I haven't completed this cut is I want you guys to see these structures here that have been cut on either side. And I'm trying to get a good angle here. So you can see all of these strings here. There's all these string looking things happening. So these are going to be your Chordae Tendineae. So Chordae Tendineae I can think of as being cords, right? So it's these strings that are attaching this kind of fleshy tissue here to this muscular tissue here, and you can also see it, oops, if I can hold it, attaching to this muscular tissue here. So this little muscular tissue that the Chordae Tendineae is attaching to is your papillary muscle. Okay, remember your papillary muscle is going to contract, and when it does so, it pulls up on the Chordae Tendineae, and that deals with this fleshy tissue here. So what would this fleshy tissue be? A valve, right? But this valve is associated with, we can see here, the thicker walled left ventricle. So this is going to be your mitral valve, okay? All right, so I'm going to go ahead and pause the video for a second so I can cut this a little bit better, and then we'll continue. All right, guys, so we are now looking at the fully bisected heart. This is still a coronal cut. I've just opened it up a little bit here so that it sits open by itself. Of course, when I did that, it broke our mitral valve, which is why I didn't do it earlier. But now that we're nicely laid out, let's make sure we're well oriented. So up in here, this is going to be our right atrium. Now our right atrium would also be over in this area. Remember, we've just flipped the heart open, okay? So right atrium on either side here. This makes this our right ventricle. And then we have our left ventricle on either side here, and our left atrium on either side here, okay? And we can also see that we have a little bit, it's probably better on this side, we have our Chordae Tendineae again on this side, a little papillary muscle there, and so that makes this valve that is going from the right atrium to the right ventricle, this valve has got to be your tricuspid valve. Okay, so then we need to go from the right ventricle, and let's see which side has the opening. Looks like this side up here has the opening. So if I kind of tilt this, you can see that this goes down deeper this way. Okay, so the septum here is covering it up, but when you pull it back, you can see it goes down pretty deep. So when we put our probe through, we're going to see that, well, you can see it's poking right there. And if I can get it to angle just right, I'm not sure I'm going to be able to get it to angle right. There we go. Okay, so we went from the right ventricle out through this vessel, confirming that we were right before, or I should say we're correct before, since we are talking about right-handed things here. We were correct before that this is the pulmonary trunk, okay? Because the pulmonary trunk, of course, is coming off of the right ventricle, okay? Because of the sharp angle here, it is difficult to impossible to see the pulmonary valve, but we can assume that it is up in this direction, okay? So then blood is going to come back into our left atrium from our pulmonary circuit. And let's see, oh, there we go. There's our hole. So this here is going to be a pulmonary vein that is depositing blood from the pulmonary circuit back into our left atrium, okay? Now, within this left atrium, again, we can see the mitral valve we talked about before. We still have our Chordae Tendineae. We have our papillary muscles. We can still see within this left ventricle that we have a very thick wall on this side. This is helping us identify it as left. We also see the interventricular septum here. And this interventricular septum is essentially the fleshy dividing line between the left and right ventricles, okay? Now, similarly, we would go from the left ventricle into the aorta. So let's see if we follow this, we end up coming out through what we had identified as the aorta previously. So that makes this hole here the aorta, and that means that some of this tissue here is probably the aortic valve, okay? Some of this stuff here is probably aortic valve, right? And just making sure there's nothing else we wanted to identify. Yep, I think that finishes this up for the sheep heart dissection. All right, ladies and gentlemen, so just finishing up, we looked at the pig heart previously from the external surface. I've already done the cuts here, so I'm going to go ahead and open this up like a book. Now, this is still a frontal or coronal cut. It still has the same surfaces, but instead of opening superiorly, it's now opening laterally. That means that this portion of the heart is a posterior aspect, and this portion of the heart is the anterior aspect, okay? Now, we can still see that we have 4 chambers, okay? And essentially, on both of these, we are seeing that we have this thicker wall here, and over here we have a thinner wall. Now, this is not as thin as we saw in the sheep heart, but it's still definitely significantly thinner than this. So this is our right heart, and this is our left heart, okay? We've still oriented ourselves the same way. Now, the main reason I want to show you guys this is there's a few features that look a little bit clearer here than they did on the previous sheep heart, just because this is a larger heart overall. One of those things being this big guy here. This is the aorta, okay? And so that makes this here your aortic valve. Okay, and that makes a lot of sense because this is your left ventricle, and blood's going to go from your left ventricle through the aortic valve into the aorta on both sides. Okay, and when we put it back together, we see that that is this structure right here, which we had identified as the aorta from the external surface. Now, let's do a little test here. We're going to take this one, which we called the pulmonary trunk, and we're going to stick the probe in it. And we stick the probe in it, we pull this open, and the probe comes out right there, okay? So that makes this our right ventricle, okay? Now, I will note here that there is some blood clot in here, which is kind of making things difficult, but we do see that it is coming out in that spot, okay? We can also still see that we have our Chordae Tendineae, which is attached to papillary muscles, and we have another really nice mitral valve here. The tricuspid valve is difficult to see very clearly. It is right here, but because of the blood clot in here, we're not seeing it very well. Okay, so overall, those are some of the structures that we're able to see in the internal aspect of our pig heart.